Right, thank you for joining us, everybody. For those of you who don't know, I'm Ben. I work on the Greater Manchester's Hidden Talent Programme, which is a youth employment programme working with quite difficult to reach young people who are neat and not claiming benefits. And we work in all 10 boroughs of Greater Manchester. This is the second video we've recorded in the last couple of weeks. The first one was talking about how our programme has kind of pivoted and adapted to the demands of COVID, and the fact that our one-to-one support has held up, and the intimate relationships our support workers have with their young people has carried on throughout this. We're going to throw our lens a little bit wider today to look at the topic of young people's mental health in work, not just the young people we work with on Hidden Talent, but young people in general. It's obviously a poignant issue at the minute, a pertinent issue. And we're going to focus on young people specifically, but I think some of the good practice we talk about will have relevance for all demographics and all people in work. I think young people, as you'll see in a minute, I'll share a few stats. There's a particular relevancy around young people's mental health in work, given some of the statistics. But yeah, it's going to be a challenging time for some young people who are starting their very first job after education. That's obviously one of life's huge transition points, and what a time to be starting work, perhaps, if you've got all sorts of fears around your family's health, your health, travelling into work if you do have to work. Working remotely throws its own mental health challenges up if you're having to work remotely. Young people who've been furloughed and coming back to work may feel very confused. There's going to be all sorts of issues there. And then we will focus perhaps a little bit more in on remote working and what can be done to help young people's mental health in that context. So I'm joined by 5 lovely guests today. Yeah, that is 5, I can count. So I'll just let everyone introduce themselves before I present a few just contextual figures around young people's mental health. So Penny, do you want to say who you are and where you're from?
Hi, so my name is Penny Robinson. I'm head of HR for the Together Trust.
Brilliant. And Meg?
I am Meg Ambrose, and I am a HR administrator with the Together Trust.
Brill. James?
I'm James Walkley, Service Manager for Youth Working Projects for 42nd Street, and manage the Mental Health Practitioner for the Hidden Talent Project.
Yeah, I should have mentioned that actually. So James works at 42nd Street. 42nd Street are a young people's mental health charity. We're really fortunate to have 2 mental health practitioners working on our programme, supporting young people who need mental health support. Jason?
I'm Jason. I'm one of the senior managers with Tameside, Oldham and Glossop Mind. And we have obviously dedicated children and young people's department, and we have been delivering mental health services. We're in our 41st year now.
Brilliant. Abby?
Hi, I'm Abby Watson. I work for Within Shore Community Housing Group as the employment manager.
Brilliant. So there's a great range of expertise that we'll be able to tap into today and share with people. As I said, alluded to just a few moments ago, I'm just going to share a couple of figures around young people's mental health at this time. So can everyone see that? Is that popped up for everybody?
Yeah.
Yeah, so I mean, we're going to be looking at young people's mental health in work, but I think it's kind of just from where we're coming from in Hidden Talent, where we're working with kind of a lot of young people who struggle to get out of the house and become very socially inhibited as a result of that. And that creates a cycle of kind of poor mental health. Being socially inhibited can lead to low confidence. That in turn leads to a mindset that isn't conducive to looking to work. That then leads to the situation not changing. And then young people can become more insular and the cycle starts again. So that's where we're at on Hidden Talent. But we've got one-to-one support to help young people get into a position to find work. And so that's kind of the preamble of where we're at. But for young people who are actually in work, yeah, the picture is not too rosy at times. So in the context of COVID, we can see that 3/4 of businesses have seen an increase in mental health support in the wake of COVID, which is obviously a really, yeah, that's quite a startling figure. And that 45 billion cost, that was pre-COVID. So I dread to think what the cost is going to be to UK employers now. With an eye to young people more specifically, young people's mental health in the workplace they are a kind of disproportionately affected group. you can see there 17.2% of 18 to 20-year-olds who took part in a survey. This was a big national survey, including huge businesses, BT, Boots, big national chains. In this vitality survey, 17.2% suffer from depression, and over half have sleep problems. And that loss of salary for that age group of young people due to poor mental health is the highest of any group. And young people are also shown to be the least likely to want to talk about their mental health in the workplace and have a conversation around that. And they're more likely to take sick days because of their mental health as well. So that's why we're focusing in on this age group, because they are disproportionately affected. So I'll stop that screen sharing there. I'll probably lead in with James and Jason, perhaps just to give a bit of context around what you're hearing about young people's mental health in the wider the population as a whole in the context of COVID. James, do you want to kind of kick us off with what you're hearing from young people?
Yeah, sure. I mean, we provide one-to-one counselling, CBT, psychosocial support, counselling for depression, and a plethora of connecting, creative or social action groups. So the feedback's different from loads of different people, and that's across GM. We're commissioned in Trafford, Manchester, Tameside, and Salford. And the general feedback from young people who were accessing one-to-one support, initially there was a bit of a honeymoon period of a couple of weeks where young people felt as though they'd be fine. And that then kind of led into quite a lot of young people pausing or just opting for telephone check-ins. And I think as the reality kind of hit in after 4 to 6 weeks that this was going to be a while, we had quite a lot of young people take up the offer of continuing support via our telephone kind of counselling or online platform. What kind of themes we're seeing at the moment is obviously boredom, kind of really accentuating concerns for young people who are already in vulnerable settings, whether that's in the family home or in supported accommodation. On the flip side of that, we've had quite a lot of young people with social anxiety who are managing quite well, but they're really, really anxious about any sort of kind of relaxation of lockdown and the thought that they may need to go back to school, college or work. Quite a lot of boredom, quite a lot of working with young people through our intensive community response service, engaging young people to maybe get them to understand the importance of observing social distancing and lockdown, but also acknowledging that maybe being at home wasn't a healthy place for them, so you can understand why some people want to get out. And really, really hearing from young people that there is nothing really positive in the media or in any sort of kind of discussions around themselves. If it's reported on, it's young people in gangs on bikes. It's never, some amazing stories of young people we're working with who are doing quite a lot of volunteering, supporting the community, generally supporting their peers. The majority have got caring responsibilities if they didn't already have caring responsibilities. So if there's younger siblings in the house, or if parents who are furloughed or aren't working have their own kind of emotional health and well-being issues or difficulties, they're also supporting parents. And I'd probably defy anyone on this call to say they haven't struggled at some point. And whether you've got an enduring condition or not, it's not normal, whatever normal is. And I think kind of my staff team are currently struggling 12 weeks in for various different reasons. I'm constantly having to remind them and myself that if we're feeling this, what are young people feeling? And then there's a huge kind of concern around transition into employment, education, training, and that preparedness for work. And I know I spoke to you about this before, Ben, about potential for another cohort of young people to either become hidden or really get stuck in that not an education, employment or training kind of situation. That's a brief synopsis.
No, there's some points I think we'll pick up on there, James, later. There's a lot of ground covered there and a short synopsis. That was brilliant. I mean, Jason, have you got anything to add to that you're hearing at top mind?
Similar to what James has said, really, to be honest. I mean, we always try and remember that every single young person that comes to us is an individual. But there are comparisons that can be drawn with young people and what they're going through and what they're dealing with at the moment, whether that's young people who are in education or have raised anxiety about returning to the workplace. And I know we'll get onto this, I'm sure, within the conversation, but young people's perception of how the workplace is going to support them through these anxious times. And picking up again on what James said, if we are all as adults recognising that we're impacted quite significantly by the current crisis, then what we really need to try to ensure is that the young people that we're working with have got the right tools to be able to manage their own mental health and well-being the best they possibly can, whilst also sort of circumnavigating the vast amount of information that we've all been bombarded with over the last 3 months.
Yeah, we'll come to information bombardment and where to go for advice in a little bit later. I know I'm suffering from inbox saturation and we're only contributing to this, of course, with this webinar, but there we go. I guess if we bring kind of Penny, Abby and Megan on this, James was mentioning there a lot about the contextual situation that young people find themselves in, carers, that home situation. Is that something that you think, we'll start with you, Penny, it's, Meg's just started work with you guys at Together Trust. Is it about, might not be the case for Meg specifically, but unpicking someone's situation when you take them on board, sensitively of course, but finding out about new employees and finding out what's going on for them, so you've got a picture of what's going on.
Yeah, and I think one of the things that Meg's probably quite involved in now is as we work to get people onboarded at the trust, it can obviously take time because of the nature of the organisation. We have DBSs to get done and references, and so we have quite a lot of contact between the HR admin team and the person joining the organisation. And actually, there's an opportunity there, I think, to get to know the person a little bit, as well as what the line manager needs to do as that person joins the organisation. And we've been running online inductions on a weekly basis to try and get people on board quicker, which I think hopefully will help them settle in quicker rather than sitting and waiting and worrying. But also the line managers have been able to come on Zoom, which actually in some ways has been an improvement from the past, because they wouldn't have necessarily been able to come to head office, all of them, on day one, whereas actually they have been able to engage with the person on day one through the new technology that we're now using.
Meg, how did you find that process of induction? Sort of, you've started a job under lockdown conditions and not meeting your team. I'm sure, I'm nervous whenever I start a new job, and nervousness in the past has provoked anxieties in me and not left me in the best state of mind. How have you kind of managed that nervousness about a new job and under these strange, weird conditions?
I don't know if we've lost Meg.
Have we lost Meg? Sort of.
She might come back in a minute.
Yeah, we'll see. I'll switch to Abby then in that case. I know, Abby, you mentioned earlier that you kind of, as many businesses have had to furlough quite a lot of young staff. Are you starting to plan how you're going to take care of those staff when they return? What considerations are you having to take into account for where young people's headspace is going to be at when they do come back?
Yeah, I mean, predominantly the young people at our organisation are apprentices, which means that they work one-on-one with a technician or another member of staff. The restrictions of the 2 metre distancing has obviously meant that they can't be paired up with somebody in a van. They're also very reliant on working physically, so somebody's showing them physically what to do. So at the moment, and that goes again to normal members of staff that are normally working in pairs. So as an organisation, we're looking on a whole at how we can ease that. Different options of how apprentices can get around to different jobs if they're not paired up with somebody else. And obviously, it's a challenge. I think James said it before, we've all suffered one way or another through this. And even as an established member of staff, we're all struggling with how we're going to move forward. Along with furloughing the current cohort of apprentices, we've also unfortunately this year had to put on hold our recruitment, which would have started back in May for a start in September. And that's for a number of reasons, that we've just not got the facility to do that whole recruitment process by socially distancing. All the colleges are closed. We don't know what colleges and schools are going to look like come September. So for those reasons, we've put a hold on that this year, which in turn will affect the mental health, I think, of some of the young people who were planning to apply for those positions. I think I said before, you know, we've got a really good reputation in Wythenshawe for recruiting young people and supporting those that have come from sometimes a troubled background. We had planned this year, unfortunately, to ring fence some of our positions to different focus groups, so those that were NEETs, you know, or care leavers. So again, that's brought us challenges. Oh, I thought I lost you there.
No, I'm still there.
Yeah, so that's brought us challenges as well in how we're going to, you know, we're not just turning the tap off there in the sense that, you know, recruitment's on hold. What we're looking at is different ways that we can continue to support those young people until the recruitment process restarts again. And obviously that's helped by the stats that you've just given us, you know, the NEET stats that we've just had through for some of the areas in Wythenshawe that are really high. But I think one of the biggest challenges is going to be changing the mindset of those young people, because at the minute the foot's off the pedal, isn't it? And you know, even adults that are unemployed are kind of seeing it as a get out jail free card, in that, you know, don't have to apply for a job because the benefits haven't stopped and they're just going to keep paying us and we're getting a little bit extra for this, and in turn that is going to fall on the young people that perhaps come from those families. So it's just about how we can help keeping them progress and stay focused and not lose sight of employment, and just really how we can support them.
Just going back to your furloughed apprenticeships, Abby, have you been able to have sort of maintain any communication with those young people to kind of just track and monitor where people are at and how they're feeling?
Yeah, we do. You know, we've had a couple that were due to leave soon, that we've actually extended their contracts for, just because again their mental health was diminishing by the minute, thinking I'm going to finish, I'm not going to have seen any of my colleagues, you know, I'm not even going to have my qualification. So we've been working quite closely to make sure that, you know, they are going to succeed and they are going to fulfill their apprenticeship. You know, and again, regular contact with the college. So all of the apprentices, although they're furloughed, have been in contact with their tutors and assessors and are continuing to work on the theory side of whatever they can do. So yeah, we are making sure that they're all right without sort of bombarding them, you know, because we appreciate it's difficult for anyone at the moment, isn't it? So we're trying to relieve what pressures we can do, but obviously keep our eye on the ball.
Thanks for that, Abby. Meg, we lost you for a second before. I don't know if you heard the start of the question. I was just asking how you found the process of starting a job without meeting your team face to face, and I was kind of referencing my own situation starting jobs before. I feel sometimes really eager to prove myself and really sort of you can't wait to get going, but you're also keen to show, yes, I can do this, yes, I can do that. And I've had worries in the past about, am I doing this right? Am I doing that wrong? How have you kind of managed those emotions through starting a job under lockdown?
I think it's the sort of halted process of starting in a new workplace. There's relationships established, but in person you can feel the room, understand what's going on and things like that, and it's a way of working through what I can add to the team but not expecting too much from me. And the team's been great to make sure that I feel well supported in what I can do, what I can't do, everyone else of their struggles and things like that. But I think it's the sort of just making sure that you acknowledge that this is a crazy time for everyone, but it's even crazier when you are starting a brand new job and first step on the job ladder towards sort of a career. And that, unfortunately, I think there is this pressure for younger people to have it all made by a certain age and everyone knows exactly what they're doing, but everything's halted now and there's so many people that will be delayed. And it's good to have a team that will recognise, like, take a break. It's okay to feel overwhelmed. You know, home working is difficult. There's, you know, Wi-Fi connections. Obviously, mine is not the best. So things like that. And I think maybe getting in touch with a couple of the staff members that you feel closer to, or I have met a couple in person, but I was also introduced into the meetings immediately. So even though I had no experience, I didn't have anything to say, I was putting them straight away to see the faces, and I recognise them, and you know, and phone numbers get passed around. So it's a different way of doing it. But I think also as a young person, I am very attached to my phone and my social medias and things like that, and that is a positive because we have more experience of sort of WhatsApp groups and texting and things like that keep us connected, and without that, I can't imagine how tough it would be if we didn't have those things in place already.
Yeah, you've touched on quite a few things, Meg. I think I'll open up to the group there and people can kind of chip in. I think the first one that jumped out to me was like your expectations. You were talking about sort of that balance between expectations of yourself and not putting that pressure on yourself, but also from a line manager's point of view. I'm not a line manager. I guess we've got quite a few here. I think probably everyone else apart from me, but sorry, go on, Penny.
One of the things I was going to say was one of the things I had to think about as a leader was how was I going to lead through this quite early on? Because I think we've, as leaders, all had to think about what is the right style of leadership, especially for all our team actually, but even more so when you're supporting young people, when you necessarily wouldn't describe yourself in that way anymore. And I think one of the things I said to the team early on was, you know, what was important to me was we all came through this together and safely. And actually, you know, I wasn't going to be looking for people to deliver what they've been delivering before necessarily. You know, this was about us doing what we could. And that I believe that everyone will be doing as much as they could through this period, with all their different levels of experience and home setups and goodness knows what else was going on, and good and bad days. But that it was that we came through this together and safely, and I'm hoping that has sort of set a tone for how we have worked through this together. And I think it's been lovely to see the team embrace some other ways of connecting, which I think Meg has absolutely got involved in and move forward for the team as well. So as an example, we have a quiz on a Friday. I think, Meg, you're doing this Friday's quiz actually, aren't you? So we have a quiz on a Friday that the team have very much started themselves. We have a WhatsApp group. We when it was the London Marathon was cancelled, we decided we were going to travel between us as a team, 26 miles between us. I think we did over 45 in the end, didn't we, and raised over £600. You know, and we did that together and had a WhatsApp group that sort of kept going since then, just sharing personal stuff. And some of those other things I think have been even more important through this. And I hope Meg's very much engaged in that stuff. And I hope has really helped for Meg as well as for other members of the team.
Thanks for that, Penny. Jason, yeah.
Just wanted to pick up on what Meg said as well, just very briefly, because I know time is precious this morning. With what Meg had said about the whole thing around expectation, I think is a really key thing to just touch on, is that when we're working with young people, and obviously as a mental health charity, we work with lots of young people. We work with Prince's Trust, and obviously schools, colleges, primaries, academies, is encouraging young people that are going into employment or already in employment to voice their expectations, and that's okay. And also equally that leaders or managers are having that reciprocal sort of conversation, and that is encouraged also around, voicing any concerns, any fears, or any anxieties that the young person might have around returning to the working environment, or just being in the working environment, or, as Meg mentioned, starting a new job in the current crisis that we find ourselves in. Is that, I suppose, encouraging that open dialogue and that reassurance that it's okay to feel the way you're feeling. And also, just to touch on what Meg had said around social media and being connected, that's always a wonderful thing, and we do kind of talk about how amazing it is that young people can be so connected so easily at the moment. But also we have to remember that the flip side of the coin is to reassure young people that it's okay to disconnect occasionally as well, because it can, if you're starting to feel negative about things, to be able to recognize that within yourself, and know that it's okay to pull back when you need to.
Yeah, I think that's certainly dripped down from my employers, Jason, the idea of like presenteeism. Let's try and avoid that. Like we appreciate not everyone can work 9 to 5 at home. Some people's best working hours will be after work, traditional working hours. Some people might need to get an early morning stint in before the kids get up and have their breakfast. And I think they've been really good at GMC Vote, saying that's not just for people with children, that applies to anyone, because everyone's body clock's going to be slightly different working from home. It's finding the time that suits you best. And I had a conversation with my line manager last week. I can't focus this afternoon. I'm really getting nothing done. Do you mind if I just get in and start earlier tomorrow? But I know that I knew the answer was going to be yes, because I've got that kind of line manager. So I guess it's like going back to what Penny says, if you set that tone earlier enough, young people would not be afraid to ask that question, because they almost can predict the answer is going to be yes. So I think that point about tone was really important, Penny.
Just on that point, Ben, sorry, just on that point, I think kind of it's really important. Obviously, you're party to the fact that we've just done a report and survey with young people and their experiences of employment and mental health. And what came through loud and clear was quite a lot of young people, didn't think that they'd be able to speak to the manager about these sort of things. And also kind of didn't feel they'd have time, or there'd be too much pressure on them within the first few weeks of work, because they need to show that they can achieve and meet a certain kind of criteria, and they're also in that probationary kind of period. So I think it's vital. Definitely within our organisation, we're doing this, but organisations that are taking on any staff member, to have that clear kind of conversation around what's available or what's achievable for that young person in relation to work. Because before coronavirus and before the pandemic and the lockdown, it's coming through loud and clear that a lot of employers weren't having that conversation about kind of young people's or staff members in general's emotional health and well-being. And it's very unlikely to come from young people who maybe it's the first job they're coming into. So it really is key. And I know that 42nd Street, we had a clear edict from the start that you can do what you can do. And if you can do 80%, you're getting paid. We understand your situation, and we're lucky to have so many diverse funding streams. And I know some organisations haven't, but it's that key message, and it's really important, especially for young people who don't want to tell their friends about their emotional health and well-being. So why would you tell your employer, if they're struggling? So, the onus is on the employer, the onus is on your manager, and to create many different routes to do that. Asking someone isn't always you're not going to get response of an honest answer. It's having those mechanisms and having that culture where you can feel like you can speak to your manager. I know I've had many of my team contact me to say, similar to yourself, I need an afternoon, or I've been working with my team to see if I can get them to take a few days here and there, because a lot of people have cancelled leave because they can't go on holiday. But I found it, I booked a week off a couple of weeks ago, and I didn't realise how drained I was until the first day of leave. And kind of the fact I didn't have to check my emails, and the anxiety about that, and the presenteeism, I needed that week off. But yeah, I thought I'd just pump in with that point, because it's really come loud and clear from a lot of young people that having that edict and being told that these things are okay, not leaving anything ambiguous and not leaving anything unsaid.
I think the only two things I'd build on what James was saying, because James really preempted some of the stuff I was going to say, but I think what I was going it was great. I think what I was going to say was, I think it's not only setting the tone, but then demonstrating that as people test that is okay and those expectations are okay, that you absolutely are dealing with those situations carefully as a leader. Because if you say one thing and then do something else, that's it, then you've lost that trust that you're starting to build. And I think linked to that as well is role modeling it through your own behavior. So I totally agree with James. I've taken time off as well, and encourage my team to, because it's been so brilliant just to be able to step away, especially with the amazing weather we've had, and not have to think about work. And I think also sharing how you feel. So if you're not having a great day, sharing with the team, sometimes you're not having a great day, so they can see it's safe to talk about not having a great day. So all of that sort of stuff as well.
Yeah, go on, Meg.
I think that's just led on to something I was going to say. When you're brand new, you can how am I going to word it? When you've been somewhere a long time, people can tell if you're having a down day or if you're not feeling your best, and it's hard to get that connection from a home working perspective, because on a Zoom call you can turn your camera off or things like that, and it's harder perhaps to read the other person's feelings. Are they just putting on a brave face for that half an hour meeting? And especially as someone new, you as a manager would have no idea if that is how that person normally looks, if they're stressed, if they're annoyed. Maybe that's just how they go about their day, and it's almost a new challenge of trying to figure out how are people feeling that I've never met, I don't know, I can't tell if they seem if the pressure's getting too much. And we're very honest in our groups of don't respond if you don't want to respond, but please do if you see something useful, a technique, anything like that. And it's creating those, it is a different way of creating relationships, but it is still the steps forward, and that positive I can take through when I do return to the office if I do have an established relationship, albeit it's a stranger one, but there is something there, that support would be there when you return. And I think making those at the very, very beginning is essential. So I think that's, yeah.
Thanks, Meg. Yeah, I think just maybe, question for, and again, anyone to answer on this. How do you, if it's all about trying to make sure that your staff know that you're there for them and that conversations, can happen at any time around how you're feeling and what you're feeling? Are there any key conversation openers or techniques that can or the language around how to ask those questions? I mean, I guess you can normalize it by building it into your recruitment process by letting people know you're a caring employer from the get-go, reiterating it in the interview, in the context of the interview, to say, mention the things we've mentioned so far. You would be remote working if you were to get the job, but we do have breakout sessions, we do have socials, we're really, really key on you getting a break whenever you need one. But has anyone got any kind of past experience on how to start the conversation in the language? Jason. Also got Abby, should we go to you first? I heard from you in a bit, and then sorry, Jason, we'll come back. Yeah.
For established members of staff, we've just had a survey, which I'm sure probably some of your organisations have done as well. Just because some people do find it so hard to open up and talk about things, and especially like Penny said, when you're a line manager and a leader, you have that added pressure then of how are you going to support your team. But actually we all have bad days, we all have days where our head falls off a little bit and you think, I don't want to support anyone, I want someone to support me for a little bit, I need that help. So we've had a survey and we've had a really good response rate. Some people have been happy to put their names to it, others have just kept that anonymous, but the results of that have actually showed that there are a really high number of people who are suffering with anxiety around COVID, working from home. Personally for me, single parent, I'm trying to wear my work hat, my mum hat, my teacher hat, and balance all those things. So I think a good opener for us is to say that it's okay not to be okay. We're fully established members of staff and not all of us are all right. So we will support you through this. I think it's important to lay out from the start that, the expectations aren't up here. We're all starting on the same level. When we all go back to our workplace, it's not going to look like it did before COVID. So I think it's important to just explain and lay out that, this is new to us all and that we will support you in any way that we can. And if that's by doing regular surveys just to get a feel of how people's anxieties are changing, whether they're increasing, whether they're decreasing, and asking for that little bit of feedback, then I think, we can all work on that together. But I think for new members of staff, it's important to get across that, we will support you. We're really lucky we have something called Westfield Health, which is an employee benefit. So they have like counselling lines and things like that. So outside of the organisation, you can ring anonymously and get support. So I think by highlighting those benefits, you know, we offer pastoral support to all our apprentices. And I know my best conversations happen on an informal basis. So I'll bump into them on the road, or if I see one of them working at a house, I'll stop and I'll have a chat, and I get the best results from that. So I think it's probably about being less formal, and even opening up. You know, if you've struggled, say you've struggled, because that will guarantee, you know, if I said to you, I've had a really bad day today, probably some of you'd go, yeah, I was like that yesterday, or last Wednesday I felt exactly the same. So I think by opening up and being honest, we'll get honest results.
Thank you for being honest, Abby. Jason?
Yeah, just very similar really in a lot of ways. I think one of the things that I was thinking about was about how important it is for businesses, particularly those who are employing young people, to really live their values. So one of the things as a mental health charity that we recognise is that we're still continuously learning and developing in terms of the best way that we can support our staff and volunteers, particularly around their mental health and well-being. So it's one thing to have an employee assist program for a business, for example. So we have that ourselves, even as a mental health charity. We have that external option for staff to confidentially be able to tap into and use as a resource. But also, it's just as important to develop that culture within an organisation so that a young person feels as though it's not disingenuous, that it's actually genuine, and that all staff are kind of subscribed into that trusting culture and feel nurtured in and encouraged in having a conversation around their mental health and or well-being. So really just kind of picking up on what everyone said, but also going back to the initial question, Ben, was we have to all collectively be a part of developing that culture within a workplace so that the young person feels like it's genuine and it's not just a box ticking exercise. One of the other things that I would just touch upon as well is that one of the things that we do internally within supervision, even though it's kind of more formal and structured, is that well-being is always at the top of the list in terms of how the conversation starts. 99.9% of the time anyway, and I think that's pretty much across the board, all teams, all departments. So that conversation is always on the table, and even if a young person might perhaps even be a little bit phased or flummoxed about being asked a well-being conversation, like how's your well-being, how's your last week been, how have your stress levels, or any of that stuff, then sometimes if they're a bit reticent, we can kind of tie that well-being question into exploring the 5 ways of well-being and how components of that could be drawn into that young person's life to help them feel better about things or feel more productive, particularly picking up on what Meg was saying before about when a young person or an adult feels like they found themselves in limbo and they're really like, oh, I'm sort of stuck between a rock and a hard place. I was on a really positive arc going up and now I've just flatlined. And that's when personal growth and well-being can really come into play and make a big difference.
I think we can expand on there. You touched on the 5 ways of well-being. The idea of where do you go to find out, that's something that as a term I'm not overly familiar with, but I think that's perhaps part of the perceived problem from employers, that it's some sort of sweet, mysterious science, mental health, which it's obviously a very complex issue, but how do you unpick it, and where do you go for your information, where do you go for your resources? I wonder if we could kind of just get a few ideas from people as to where they've gone to in the past and what's really worked. And I can include links beneath this video for people afterwards of the best. We're not going to reinvent the wheel from GMCVO. There's plenty of other stuff out there already, but what's worked for you, I guess. Penny, you had your hand up.
Yeah, no problem. I mean, I totally agree with the survey. We had a massive response as well from running a pulse survey. So I think understanding how your workforce feels almost becomes the beginning of that, and continuing to do that. So we've left that open and we look at it every couple of weeks. And I think we've one of the things we've done at the with every new join is I come on, or the training team that will come on and talk about the support that's available. So REAP, Able Futures, which is a DWP or Indius run organisation that offers 9 months worth of counselling as long as you're employed and paying national insurance. And also we have mental health first aiders. So we've created an email address so people can get hold of a mental health first aider if they can't find them in their workplace as they normally would. I think in terms of other help, we've pulled together some sort of one-page fact sheets, because there was lots of, it's been overwhelming the amount of stuff there's been around mental health to do with COVID. And we were trying to find something that pulled together some information, but almost in bite-sized chunks that people could deal with, because a whole booklet or a whole raft of stuff, you just can't find what you need. So we've created, for example, one on feeling overwhelmed and anxious, one on sleep, one on eating well, one on exercise, and we've put them almost as bite-sized chunks on our Togethernet, and in that are all links to places like Mind and other organisations, so that people can then link in and get further support. But also, you know, in the exercise one, we've linked to Joe Wix's PE routines and yoga and stuff like that, because I think it's people, as somebody said earlier in the call, you know, we're all individuals and people have to find the things that work for them. We've published a one-pager wellbeing plan that people can complete, and hopefully are using all of these resources together to try and do that for themselves. But I'm quite sure we've still not got some people to access that. So we need to keep communicating that every Friday.
Yeah, I think with kind of whatever resources, whatever things you can put in place, you know, statistically, there's always going to be some people that won't feel open enough to have a conversation, or kind of will indirectly get the nourishment they need to support their emotional health well-being separate to those structures that you put in place. We've got kind of check-ins and emotional health well-being check-ins for every team meeting, every group, every young person's group. The culture of 42nd Street is anything that starts with that. So it's pretty much you pick it up on day one. But I'm that kind of personality, and I think there's a couple of other people in the organisation that I don't necessarily dip into the resources in work, and there's more than enough, but I do have external supervision, and I do have a network around my work that I can speak to. I can speak to colleagues in different partnership organisations. I think it's great to have as much resources and as much information as possible, and I think you need to, but I also think sometimes it's okay to have that conversation with a member of staff who's getting what they need elsewhere, and not feeling that sometimes it can pressurize people to think that I need to go to Brew Mondays. Yeah, of course you can go. Right. Not a problem. You're very polite. Yeah, so kind of we have Brew Mondays, we have quizzes, we have morning check-ins that meet the needs of about 60% of people. And then I know members of my team that I can call on spec and just have that confirmation. Cinnamon. Just to acknowledge that member of staff just needs a call once a week. I've just received an email from a once a call person who lets me know we were checking in daily, and that was stressing the hell out of her and raising that anxiety. And I think it was my anxiety. I was calling that person. If we were in the office, it would have been anecdotal conversation. So I think there's a sliding scale of what works for different people, and it's really hard to formularize it. But the key things are have things up in your organisation, have a huge amount of resources, discuss it, share when you're struggling or when you're frustrated positively, and just try and kind of put as many different options and opportunities available for people to talk, and be aware that some people just won't. They'll have to get to a point where it's really unmanageable and there's not much you can do about that, apart from be there when that happens and have those conversations. And it's easier in the sector that I work in for me to be a bit more flexible. We're not making so many products in an hour. We're not having to man tills. So I know I'm coming from a privileged kind of setting where emotional health and well-being is something that I take on board. And if a member of staff is struggling, I'll give them some time to themselves, or we'll look at a phased return back to work. But I'm aware that can't happen in all settings. But I think it's really, really key for anyone who's a manager or anyone who's supporting young people to come into an organisation to work or to volunteer or as interns, to understand that you can't fix it with one particular process. It's constantly refreshing, renewing that, and looking at looking at what works for individuals. And I'm the worst person for my manager, because I get my support outside of the work setting, and I make sure my manager knows that, so she doesn't think she's not meeting a need, if you know what I mean. So it's communication is key in that. Sorry for the interloper.
No, don't worry about it. I think, I could just try and wrap this up next 5 minutes, I think, but we could talk for ages about this sort of stuff. It's really interesting, and everyone brings their own perspective because everyone's got mental health. I think, James, the idea that people are all different and you're not going to please everyone with the same technique is really important for line managers to acknowledge. My line manager was sort of saying, "Oh, Ben, we've not seen you in the lunchtime social yet on a Friday. We have it blocked out on our calendar." But for me, I need to get away, and sort of my idea of that break is going out and doing a Joe Wicks, or going out and going for that run, going and skipping in the back garden, doing some keepy uppies. That's me getting away from the screen and doing something that's good for myself. And she was totally cool about it. She was like, "Oh no, yeah, I get that." But it's about line managers realising that it's horses for courses, I think, isn't it? But I guess that's sort of, leading on from that, line managers, that's the key thing it seems to be. You're the enablers of positive mental health, Penny, Abby, for your workforces. It's how, you strike me as naturally empathetic people who would do a good job of that, but for every 2 of you, there's maybe 10 who aren't, and that's through no fault, perhaps. That's just not where some people's skill sets lie. So I guess, the implications are training, but where to train and who to train with. I'll try and include some links on the bottom of this, because I know that kind of line manager training goes on all the time. But has anyone seen any or attended any really positive mental health line manager training, just to kind of bring this to a close, really?
Yeah, I'm so pleased we did, but obviously without the foresight of what we were going to have to deal with this year, it was more just in the context of ongoingly. We linked up with ACAS and very much looked at their model around mental health, which looks at what does an organisation need to do, what do managers need to do, and what do employees need to do. And they ran a number of sessions with most of our managers last year around mental health and their understanding of it, and how you could support it as a manager, as well as a number of sessions with employees to understand how it felt working for the organisation and some of the challenges around their mental health and them understanding their mental health. And that then fed into a conversation we had early this year, just before COVID, around what sort of things the organisation needed to do at an organisation level to move mental health forward. And that is still going to be ongoing work, because obviously COVID's got in the way of that, but definitely their structure of training was very useful for us, and I thank goodness we did that last year, really, to enable us to be where we are now.
Thanks, Penny. Jason.
Just kind of picking up on what Penny said, I think she makes a really, really important point there, whether it's ACAS, whether it's another a training provider. What we found with businesses and employers that we've worked with over the last few years, and I think as workplace health has started to be taken more seriously, people have seen often it comes through necessity. People see the cost implication to a business, and then they suddenly decide we need to think about workplace health and make it better. But one of the things that we've found is that it needs to be a top-down and a bottom-up approach to developing that positive culture within the workplace, so that everybody's kind of equally bought into it. One of the other things I would say as well is not just for front-facing staff, but also for line managers, senior managers, CEOs even. We've got Connect 5 training rolling out across Greater Manchester at the moment. So sometimes people will falsely say, I don't feel confident in having a mental health conversation, when actually it's that they feel uncomfortable having a mental health conversation. Other times people will say, I don't feel confident having a mental health conversation because they genuinely don't feel confident. And that's where I would encourage anybody and everyone to at least maybe try and carve out a little bit of time to look at Connect 5 and possibly sign up to at least do module 1, which is just 1 day's training, because we really want to, and I think collectively we are capable of genuinely creating like a ripple of change, at least across Greater Manchester, so that everybody feels positive and confident about having these types of conversations, that it's okay, that there isn't any stigma there. And I think if there's a silver lining to be found in everything that we've all collectively been struggling with over the last few months, is that it actually puts this much higher on the radar for people, and it almost gives people permission to say it's okay, we can have these conversations now, and we're all impacted in the same way.
Thanks, Jason. Yeah, I know Connect 5 was rolled out to some of our staff actually a couple of years ago, and I was really miffed actually. I couldn't attend because I had loads of other stuff. I was writing a report, I think, at the time, and I think in retrospect the Connect 5 would have been more important. But yeah, I know it was well received. Thank you.
Do it now, Ben. Do it now if you've got time.
Well, I've just had some training pulled actually, so I've got a gap in my calendar for some training. So yeah, perhaps that's the way to go. Meg, I thought we'd just finish with you really, actually, just the last point before we end this. Kind of what's been the doesn't have to be the number one thing because you might not be able to boil it down to one thing, but what have you appreciated the most in terms of your welfare from your employers, having started a job remotely? What's been the biggest thing for you in terms of a support mechanism?
I think it's that regular contact, and it's nerve-wracking at first to ring someone you don't know and have never met and speak through things, but practice makes perfect. You realise how they best work, they realise how best you work, and it's that regular contact. And you know, sometimes even if you think, oh gosh, I really can't be bothered to do that one today, afterwards you realise that was the best thing, because you could hear other people's stories. Oh, I've had a terrible morning. Oh, I've had a great morning, you know, and everybody recognising that and feeling included, because it can be lonely and you don't have those relationships yet of sort of friendships in the workplace just yet, but it's feeling included and learning about people outside of their job role, things you've got in common. Me and Penny talked about what we had in common, and that made it so much easier to then establish, right, I don't just see this person as this job title, I see them as this person that enjoys this, and things like that, just establishing those connections that really just make a workplace better. And it's to remember to put those in even when you're not in the office or in the workplace, I would say has been the most helpful.
Ringing endorsement for you there, Penny.
Thank you.
Thank you for that, everybody. Yeah, there's a real a range of opinions there, and some really good practical advice as well. I will distill it and try and include that in some key points under this. It might be that I chapterise the video. But yeah, thank you for whoever's watched this as well. Yeah, links I think to important resources are below the video as well. Some of the points in the trainings that have been referenced, the ACAS training, yeah, there'll be links below. Thank you very much, everybody, for your contributions. Yeah, fascinating conversation. It's a conversation that's not going away, like Jason said. It's this is firmly on the agenda now. So yeah, thank you very much.
Thank you.
Lovely to meet everyone.